Hi everyone, welcome back to the channel. My name is Dr. Daniel. So today we are going to talk about something that is very common, pneumonia. Pneumonia has a lot of myths around it. I lived in Nairobi for 5 years, and most of you who have been in Nairobi, you know that it is a very cold place. So many people here believe that excessive coldness can actually cause pneumonia. So by the end of this video, you should be able to know what pneumonia is, what are the causes of pneumonia, how it can be prevented, the myths around pneumonia, and how it can be treated. Many people ask me a question whether coldness actually causes pneumonia. This is actually a myth. Pneumonia is a disease of the lungs. Pneumonia means accumulation of fluid or water in the lungs. This fluid can be caused by infections such as bacteria, the commonest, viruses. As most of you remember, we had a pandemic called COVID. COVID caused something we called a COVID pneumonia. So this is just another type of pneumonia we call a viral pneumonia. Other causes of pneumonia could be chemicals, what we call a chemical pneumonitis. A fungus, which is a type of a microorganism, can also cause pneumonias. One can also have a pneumonia when food leaves their food tract and goes into the lungs, what we call aspiration pneumonia. We also see pneumonia among bedridden patients. We call that a hypostatic pneumonia, and it's majorly because someone is oversleeping on that particular side. So fluid or water will gravitate and will lie in the lower bases of the lungs, and they end up with what we call a hypostatic pneumonia. Diseases like TB can also cause pneumonia, what we call tuberculous pneumonia. So, like I've just shown you, pneumonia is not because of coldness. Pneumonia is actually an infection. When your child has pneumonia, please take them to hospital. Some of the signs of pneumonia include fast breathing, cough, high fevers, difficulty breathing. In children, they can have convulsions, they can have vomiting, they can have irritability, the child is crying excessively or inconsolably. It is believed that people who cook inside their houses, especially on charcoal stoves, are at a risk of developing pneumonias. But of course, other risk factors of pneumonias are reduced body immunity. People who excessively drink to the point of getting unconscious are at a risk of getting what we call aspiration pneumonias. I'm sure you have seen doctors listen to the lungs, what we call auscultation, and that is how a pneumonia can be picked up by the doctor. Among the tests that can be done to pick a pneumonia are chest ultrasound in young children, chest x-rays, and chest CT scans. If you like this video, share, subscribe, and hit the notification button so that when we post our next videos, you'll be able to know. So the treatment of pneumonia will depend on actually the cause of a pneumonia. If one has bacterial pneumonia, it will be treated with antibiotics. If one has a viral pneumonia, it will be treated as a viral pneumonia. Remember that viral infections are not treated with antibiotics. It is very important that you only use antibiotics when they are prescribed by the doctor. If it's a pneumonia caused by TB, you'll be given anti-TB drugs that will help you treat the TB infection, which will eventually take out the pneumonia. It's very important that you have regular checkups by a doctor that can help you prevent complications associated with diseases. Pneumonia is curable and can be treated completely. So it is a myth that pneumonia is not curable. If you have questions or you need assistance regarding the same, feel free to contact us on the email put on the screen below. So I will say bye-bye from Sadok Health till we meet in the next video.